Congratulations on getting started with your orthodontic treatment. Our office is going to give you the best smile and bite possible. We're dedicated to it. However, we just can't reach all the treatment goals that you deserve without help. Your help. Paying attention to the following instructions will help us give you a beautiful smile and a healthy bite. And while you're in treatment, you must continue to see your family dentist for regularly scheduled cleanings and checkup appointments. To prevent damage to your teeth during your treatment, thorough oral hygiene is imperative. Poor or mediocre care of your teeth can and probably will cause permanent and unsightly damage to your teeth. Don't let this happen. Develop a pattern of brushing that covers all the surfaces of all your teeth. Brush the entire surface of each tooth using an oval or circular motion with the toothbrush. Tilt it and brush slowly around the braces. That's where plaque and debris accumulate. Concentrate on the area between the braces and the gums, gently placing the bristles under the gum tissue. Focus on spots that have hooks and attachments because plaque and food particles accumulate there. Brush the chewing or biting surfaces of the teeth and the inside surfaces of the teeth, and don't forget your tongue. Your teeth and appliances should shine after each brushing. Brush after each meal or snack and at bedtime. Floss between the teeth at least once a day. Use a fluoride rinse at night. And you can always swish water vigorously between your teeth whenever you have the chance. The added benefit is substantial. For areas between the teeth, flossing is important to prevent cavities, infected or swollen gum tissue, and permanent white spots on the teeth. The key to flossing is to get the floss under the arch wire. You can do this several ways. Use a floss threader with a length of floss, or you can use a type of floss that has a stiff end to make it easier to place between the teeth. Or if the gum tissue between the teeth is not in the way, you can use plain floss and manipulate it under the arch wire. When using floss, place it under the arch wire and wrap it around the side of one tooth in the form of a C. Move the floss up and down gently, making sure it goes under the gum tissue. Then do the side of the adjacent tooth and remove the floss. Repeat the process between the next two teeth and continue around the arch until you have cleaned the sides of all your teeth. It does take a bit of time, but this way you can prevent dental disease and shorten your treatment time. It's well worth the effort. There is a special kind of brush that's used for those hard-to-reach spaces around your braces. It's this little guy, a proxy brush. Place the proxy brush under the arch wire and gently clean around the attachments and under the wire. If there's space, gently push the proxy brush between the teeth with a rotating motion. Don't force it, but try to do this between all of the front and back teeth if you can. Certain foods have to be avoided or changed in order to avoid damage to your braces. That can help save unwanted costs for repairs and delays in your treatment time. No gum or sticky foods such as caramels, licorice, now and later, Starburst, or Skittles. Avoid hard foods such as nuts, hard candy, hard pretzels, hard taco or tostada shells, crusted bread, and tortilla chips. Minimize your sugar intake. This means avoiding cookies, candy, soda laced with sugar, and high-sugar fruit juices. These foods, in combination with braces and without scrupulous oral hygiene, are disastrous. Remember to brush your teeth or at least rinse vigorously with water after eating or drinking anything sugary. Cut apples and carrots into bite-sized pieces. Cut corn away from the cob and meat away from the bone. It is not unusual to experience some soreness or discomfort from orthodontic movement, especially after an adjustment appointment. This usually lasts from 1 to 4 days. Over-the-counter analgesics such as Advil, Motrin, or aspirin will help to alleviate this discomfort. For children under the age of 12, use the dosage recommended for children indicated on the label. Warm saltwater rinses also are helpful in reducing the swelling of irritated gums or cheeks. 1 teaspoon of salt to 8 ounces of warm water is recommended. Also, topical anesthetics are useful in relieving the discomfort from fever blisters, cold sores, irritated cheeks, or sore gums. Use them according to the labeled instructions. They are available at your local drugstore. Periodically clenching on a specially designed piece of supple plastic called a bite wafer is also a significant benefit in relieving the tooth soreness that occurs after an orthodontic adjustment. It's essential to do your clenching exercises immediately after the adjustment appointment to intercept discomfort before it gets started. This will help you continue your normal routine and to eat your regular foods without any pain or inconvenience usually associated with having your braces tightened. While we cannot guarantee results, this has proven to be extremely effective for lots of patients. Habits that can be harmful to appliances include chewing on ice, pens or pencils, fingernails, and picking at your braces. They not only knock bands and brackets loose, they also bend and distort the arch wires, which results in your teeth moving in the wrong direction and greatly increasing your treatment time. A good rule of thumb is not to play with your braces, and when it comes to food, if it's hard or even sort of hard, don't chew on it. Mouthguards that fit over your braces should be worn while participating in any contact sport. Your orthodontist can provide these protective devices or tell you where you can purchase them. A bracket or a band can become distorted or displaced, and it's usually because of eating the wrong foods, chewing on something hard, or picking at your braces. It's not an emergency unless discomfort is involved. However, you need to call the office to schedule an appointment to replace the damaged loose band or bracket. You'll be seen as soon as possible. These appointments require some extra time and usually can't be done after school or work hours. If a rubber elastic ring or tie comes off, we can get you in for a short visit to have it replaced. In areas where there is a long span of wire, it may come out of the back tooth. If this happens, you may try to reinsert it into the tooth using a pair of tweezers or place wax to hold it in place. As a last resort, you may cut the wire next to the closest bracket using a nail clipper or a small wire cutter. Remember to call your orthodontist before attempting this. For a pokey tie wire or a wire poking out of the back braces, we suggest that you use the back of a pencil eraser to tuck it out of harm's way. If that's not possible, use a piece of wax to cover the area causing the irritation until you can get in for a quick visit. Apply by pinching off a small portion and rolling it into a small ball. The key to getting the wax to adhere is to dry off all saliva around the irritation. Then place a small ball of wax where it's needed and gently mold it with your fingers until it's comfortable. Remove the wax to eat or brush and reapply if necessary. The doctor will give you an ample supply of this wax when you get your braces. And remember, whenever you are having difficulty, feel free to call the office so that your questions can be answered and the appropriate appointment can be scheduled. Don't hesitate to ask your doctor any questions you may have. We hope this information you've seen and heard will help you in working with your doctor to obtain that beautiful smile you deserve. There are many aids available. Ask your orthodontist which products he or she recommends.